Hernia repair is one of the most common surgeries out there. But how we fix them today? Well, that's a whole story. A really cool journey, actually, from brute force to some pretty elegant engineering. So let's dive in and break it all down.
Right, so we've all heard the word hernia, but what is one really? Like, what's actually going on inside your body? It's actually a lot simpler than you'd think. Okay, the best way to picture it, think of a car tire. If there's a weak spot in the rubber, the inner tube can bulge out, right? That's basically a hernia. Your muscle wall is the tire, and some part of your insides is that inner tube pushing through. And the whole point of a repair is, you guessed it, to patch that tire securely. So to really get why modern repairs are so good, we've got to go back in time. We have to look at how they used to do it. And for a long, long time, the approach was, well, let's just say it was direct, but it had one giant fundamental flaw. The logic back then seemed simple enough, right? If you've got a hole, just pull the edges together and sew them shut. That's exactly what surgeons did. They'd find that weak spot and just stretch the patient's own muscle and tissue to cover the gap. You can probably already see where this is going. And that brings us to the villain of our story, tension. See, by stretching tissue that was never meant to be stretched, the whole repair was under constant strain. Imagine pulling a t-shirt really tight and trying to sew it. The stitches are just going to rip through. And that's what happened. Sutures would tear, and boom, the hernia was back, sometimes even bigger than before. So this whole problem with tension, it forced surgeons to completely rethink everything. It sparked a total revolution in hernia surgery, which led to what we now call the tension-free repair. And this was a massive shift in thinking. I mean, instead of pulling and stretching tissue, surgeons started asking a totally new question. Hey, what if we just patch the hole? And just like that, the tension-free repair was born. The whole idea became about reinforcing the weak spot, not straining it. And if tension was the villain, then the hero of this new era is definitely the Lichtenstein repair. It's a technique that solved the tension problem so brilliantly that it's still the gold standard for open hernia surgery today. Pretty amazing, right? And the beauty of it is how simple the concept is. The surgeon goes in, lays a small piece of sterile mesh over the weak area, just like patching a pair of jeans, and secures it. Then the really cool part happens. Your own body's tissue grows into and around the mesh, creating this super strong, permanent reinforcement, all with zero tension. And you know what? The results totally speak for themselves. Because you've gotten rid of that tension, the repair is way more durable. That means the hernia is much, much less likely to come back. On top of that, it can often be done with just local anesthesia, and it's a super reliable technique that surgeons everywhere know how to do well. Okay, so the tension-free idea was a game changer. It was established. The next big step wasn't about what to do anymore. It was about how to do it with even better tools. The goal was exactly the same: put in a mesh patch, no tension. But now, surgeons figured out a way to do it through a few tiny little incisions using a camera and some really specialized instruments. And that's what we call laparoscopic or keyhole surgery. So, when would you want to go with this keyhole method? Well, it's especially great for a few specific situations. First, if someone has hernias on both sides, a surgeon can fix both at the same time through the same small cuts. It's also a go-to for fixing a hernia that's come back after an old-school open surgery. And for athletes or just really active people, it often means a faster recovery. Now, even with keyhole surgery, it's not just one size fits all. There are two main flavors. The first one is called TAPP. For that one, think of the surgeon going into the main belly cavity and placing the patch on the muscle wall from the inside. The other one is called TAPP. With TAPP, the surgeon works in a space between the layers of the abdominal wall, so they never actually enter the cavity with all the organs. TAPP is great because there's less risk of injuring anything inside. But, it's definitely trickier for the surgeon to do. All right, so we've got open repairs, we've got laparoscopic repairs, we've talked about tension versus tension-free. Let's kind of pull all this together and figure out how a surgeon actually decides which repair is right for which person. This brings up a really common and important question. What about kids? Do they get a tiny mesh patch too? It's a great question because it gets at a crucial point. Not all hernias are the same. And the answer is, surprisingly, no. See, a hernia in a child isn't usually from a weak muscle wall like it is in an adult. It's actually because a little tunnel they have before birth didn't quite close up all the way. So the fix is way simpler. The surgeon just needs to find that little opening and stitch it closed. There's no weak wall that needs reinforcing, so no mesh needed.
And when you actually look at the numbers, the difference is just staggering. Those old tension repairs, they had a pretty high chance of failing, of the hernia coming right back. But when surgery switched to the tension-free mesh repair, that recurrence rate plummeted. And at the end of the day, that's what matters most, making sure it's fixed for good. Okay, so let's boil this all down. What are the key takeaways here? First, modern hernia repair is all about being tension-free. That's the golden rule. Second, surgical mesh is the standard of care for making that happen. It's what reinforces the weak tissue. Third, laparoscopy, that keyhole surgery, is an incredible tool, especially for those specific cases we talked about. And finally, the whole goal, the entire point, is to prevent recurrence, to fix it once and fix it right. So what's next? I mean, we went from stretching tissue apart to patching it with a permanent material. What's the next big leap? Maybe a smart patch. Imagine something that supports the body, encourages it to heal and rebuild its own strong tissue, and then it just dissolves away, gone. It's a pretty incredible thought, right? And it just shows how far this whole field has come.